Assalamu alaikum wa rahmatullahi wa barakatuh, my dear brothers, sisters, viewers of Iqra TV. Welcome to another edition of Real Talk. I'm your host, Iqbal Bana. I'm sure you're familiar with this program. I've been doing it and I'm coming into your homes for a number of months and years now. Today, as I say every week, I want to talk about something that is of importance to our community, not just our community, all communities. And we try and bring you subjects and issues that are important to the Muslim community in particular. So last week, for example, we spoke about Islamophobia, and we had two very important guests on our program. The Police and Crime Commissioner for West Yorkshire, who was also the lead for the National Police Chiefs Council, the Police Association across the country, and the most senior officer responsible for hate crime or managing hate crime in this country as well. Today, I want to talk about mental health and issues affecting our community and all communities, as I say, around mental health issues, etc. People have been saying to me for a number of months that this is a growing issue in our community, something that we need to talk about. Unfortunately, we don't really talk about mental health to the extent that we should do, and how mental affects Muslim communities and families, both elderly, young people, etc., across a whole range of ages. It's not just something that affects elderly people, it affects young people as well. And the number of cases and issues over the last few years, particularly after the pandemic and during the pandemic as well, have exponentially really grown. And I also want to talk about whether the institutions, the NHS, is aware of some of the challenges that are being faced by our community, and whether it's accepting and acknowledging some of these issues and doing anything about it in order to respond to the needs within our community. And to that effect, I have somebody who's very familiar to viewers of Iqra TV, somebody who I found out today, or I should have known. It shows how much research I'm aware of and some of the past history of Iqra TV. Dr. Wajid Khan, who actually did a number of programs on some of these issues a few months ago with another colleague of his. But unfortunately, because of time commitments and other factors, he was not able to carry on. But he did quite a few episodes around particularly well-being and mental health for Iqra TV and viewers of Iqra TV. So, and today we are also hoping to get a sister who works around mental health to come and join me, but unfortunately is not able to do so. But we will inshallah come back, because it doesn't just affect men, it affects women, it affects families. So these issues are important that we cover all areas as far as we can. Dr. Wajid Khan Sahab, psychologist, associate specialist, clinical psychologist and forensic psychologist. My goodness, the amount of work you do is unbelievable. Welcome back to Iqra TV. I'm sure this has been a welcoming home for you, I hope, for the familiarity of the studios. Welcome to Iqra TV. Thank you for giving me your time and allowing our viewers to hear from you. Just to remind you, if you want to ring in, then please feel free to do so. If there's any issues that you want to ask about around mental health issues, then please do so. Inshallah, Wajid will try and answer those as much as he can. The phone number, as I keep saying every week, is 01274 214 299. So let me turn to Wajid Sahab. Wajid, as I say, welcome.
Thank you.
Mental health is an issue that affects all communities.
Definitely.
But particularly within our community, because of the family structures that we have, the close family network that we have within our communities. Sometimes some of those issues are compounded by some of those factors. And as you know, over the last few years particularly, we have seen an increase in suicides within our young people as well in our community, unfortunately. Now, have you as a professional practitioner seen this trend increasing over the last few years in particular? Or is it something that has always been there?
I think firstly, just to say Jazakallah khair for inviting me back and everything. Assalamu alaikum to all the viewers and everything. MashaAllah, it is nice to be back in the studios, and it does bring back memories and everything. Alhamdulillah, you know, since actually we started doing the initial shows around mental health and well-being on Iqra and other platforms and everything, the awareness in our communities has grown substantially about what is mental well-being, how do we deal with it, how do we get support and things like that. But unfortunately, as the challenges have also increased not just because of the pandemic, but also the social stresses and things like that. All these things have increased. So it has unfortunately gone up, and you have seen a marked increase in the number of people, particularly young people,
Yes.
who not just taken their lives, some of them have taken their lives, but others, you know, from a range of issues, to self-harm, to neglect and so forth. And it's also thinking about, what do we mean by mental health and well-being? Because something can be bothering somebody, whether you're stressed or anxious, you've got an exam or something like that. But actually, when that feeling stays for a long time, where you can't shift it, where your motivation changes, or your eating habits change, your sleeping habits change, and your whole routine of your life changes, and then you can't shake that change, where you feel powerless against that change, this then actually starts to become a mental health issue. And it can affect, and I'm really glad you mentioned at the beginning that it can affect old, young, you know, it doesn't matter who you are, it doesn't matter what color you are, it doesn't matter how much wealth you have or no wealth, it can affect anybody and everybody. And
doesn't
doesn't differentiate.
It doesn't discriminate between social status or male or female.
No, male, female. It does not. It doesn't matter. Every single individual.
But in your sort of experience and your professional judgment, are there particular age groups that are affected more than others in any way? Is there any research around that?
There is plenty of research on individual issues that face specific age categories.
Right.
Yeah. There is research, but it's very difficult to compare. Like, you can't really say one age group has more issues than the other, because actually each of the age groups has different issues. So what I mean by that is, young people may have issues around, you know, substance misuse or illnesses or challenges, anxieties and things like that, whereas the older generation may have more issues around dementia or more neurological issues. So the categories are very different, and the principles are very different, and each of the age groups, male, female, young or old, will have specific challenges. I suppose, going back to your original question, has there been an increase? I think there definitely has been an increase. On one level, the increase is because of the challenges people face and the stresses people face, but also there's been an increase because people are talking about it in a more open way as well. So like I said at the beginning, you know, since actually we first did the shows here, we did a number of shows talking about the variation of illnesses that people can go through. So anxieties, to depression, to trauma, to actual substance misuse issues, to neurological issues like dementia and Alzheimer's and things like that. And you know, these are some of the broad categories I'm mentioning. And since then, though, actually, I've personally noticed an increase of people who are coming forward, whether it be families, whether it be individuals, saying, actually, you know what, there's something not right here. I need to get help. Actually,
that was the question I was just written down. Is there more recognition now that these issues need to be addressed? Because in the old days, I mean, you know, it's well known that, you know, if somebody had mental health issues in particular, that we used to try and hide them away. I mean, it happened in this country as well. There are cases of members in the royal family are alleged to have been pushed out, you know, of the view of the rest of the world, and sort of incarcerated into into house arrest. So it's not unusual.
No.
But we know in our sort of back home in our communities, mental health was seen, you know, is pagale, isko harado, isko chuvado. Hide them away somewhere. So that is obviously changing, isn't it?
It is changing, and don't get me wrong, there is still stigma. There is still a huge barrier to how people access services and get support, and what type of support they get, and the challenges people face in that support. But actually what's different is that actually people are willing to actually seek help now. Whereas before, and even now, I suppose, you know, people will wait a long time before they seek help. And that's kind of one issue that I really wanted to touch upon, because what happens with a lot of Asian or black people when they come into services is that they often come in at crisis points.
Right.
Yeah, where the point of crisis has already occurred, where the stress has built up, the dementia or the depression has built up, and they can't control it anymore. They can't contain it. They can't hide it. And then what happens is when they come into services, unfortunately, it's a crisis point, and services are struggling to help them, because the only way you can help them is by looking at medication or support or high intensity support regimes like that. So one of the real challenges that we've got is to help people access the appropriate services in the appropriate time, and use the right language, to say, look, I need help.
But just, I mean, obviously you're saying that, you know, services are there, but I know for a fact, for example, you know, it's well documented that services were not culturally or religiously suitable, or they dismissed some people, particularly African Caribbean people, when they displayed some mental health issues as being more cultural than anything else.
Yeah.
All right? And that was the norm. So are we saying that services now are much more aware of and want to reflect the outcomes or the diagnoses that they offer?
They are aware. Whether that translates into the help and translates into the diagnosis, you know, the jury's out on that, really.
Right.
Yeah, the jury's out on that, in the sense that sometimes the services are under pressure, but sometimes the quality of the service may not be there either. And I think the challenge is, though, that to actually encourage our communities to get involved in those services, to make them culturally representative, to make them aware of the culture and the traditions and things like that. And I think one of the big challenges is that actually people sometimes, as I say, wait until they get to a crisis point, and then it's so difficult to even put any support mechanisms in. So if you're Black or Asian, you end up staying longer in the inpatient facilities. You end up facing quite a lot more stigma, a lot more intensive treatment, and clinical treatment is poured in. And often what then happens is, you know, people will come back to me and say, well, Wajid, we went into the service, we went into to get help and everything. All we got was either drug regime, or, you know, I was stuck in the hospital for so many years, or my family member was stuck in the hospital so many years, and he's still exactly the same. And the problem with that is because they've come at a crisis point, to put in any interventions, or to help reset that individual so that they can actually be functioning and helped in the community, is very difficult.
Yeah, I mean, that's fine. I mean, but the ability to recognize when to go for help is one of the crucial lines that you have to cross.
Yeah.
So do you think that in our community, that is one of the, as you've mentioned, that they come in quite late to access the services? So what are the symptoms that people should be looking for, which says, okay, now we need to have some intervention? And how, I mean, and, you know, I think we're going to be doing a program, we've been saying this for a long time, where does this issue about taweez वगैरह comes into, you know, there's a lot of people who do taweez. इसको तावीज़ कर दो, इसको पानी लिया कि इमाम से कोई पानी लिया दो, पिला दो उसको, सब ठीक हो जाएगा. You know, if you have a taweez and you do some water treatment, you know, park water treatment or whatever you want to call it, does that interfere in the work that you do sometimes? And I know in the past it's proved to be quite damaging to individuals as well.
Yeah, and don't get me wrong. I think looking at the spiritual angle of somebody's challenges is important.
And it does play a very positive role in times.
No, it does. And we were having a conversation earlier about how this can help recovery and challenges and manage the recovery process for that individual. I think the problem is one is the stigma of not understanding or trying to hide the issues that are happening. The second is people are often so used to just marching on or trying to fight it. They don't even realize that they may be suffering from, you know, low mood or anxiety or various other challenges. They may be carrying different traumas and what have you. And in broad terms, I'm talking about what we understand as mental well-being. I suppose some of the triggers that you should look at is, you know, thinking about individuals who may suffer from overeating or undereating. So if you go into a service, people will say, well, how's your sleep? You know, how are you sleeping? How's your daily routine? Has that changed? Yeah. So these are basic assessment questions, you know, people will ask you if you go into a clinic. They'll say, well, what's different? What's changed? Yeah. Or have you been under more stress? Why have you been under more stress? Have you been, you know, something happened, has changed your routine and things like that. So these are the things to be aware of, in the sense that, hang on a minute, I'm not sleeping really well. And some of this you can resolve yourself, you know, by adjusting your routines and thinking it's okay to feel tired, it's okay to feel anxious, because anxiety or feeling tired are warning signs that the body sends you, to say, actually, you know what, you might need to do something differently. The challenge occurs is where, going to one of your questions that you've asked, is whether the Taweez and things like that pose as a hindrance or can help, you know, resolve the situation. 99% of people who suffer challenges or have mental health issues often say that actually they have been to an imam or they've asked somebody.
99%?
99% of individuals will all, you know, we carried out a research project on all our mental health facilities at 3 different time points over the last since 2005 to now. We've carried out research projects, and often we've gone back, and people have always said that actually I've gone to the imam first, I've gone to this person first, I've gone to that person. And that's fine. Actually, there's nothing wrong with that, because actually what is the person doing? They're trying to work out what is happening in their life and how to solve the problem. So there is nothing wrong with going to the imam or whatever. The challenge,
except those who fleece people.
Well, yeah.
I mean, that's another subject. But there have been so many victims of sham imams and Taweez providers.
But that's the thing.
That's a different subject. Yeah.
That's the thing.
And these are vulnerable people.
These are vulnerable people.
Very vulnerable.
So what I always say to people is, do that, but also go to your doctor. And often you need to push your GPs to say to them, look, actually, I'm not feeling well, this is happening, this is happening. And actually, some people may want medication, some people may want psychological therapy, some people may want IAPT, which is improving access to psychological therapies, which is low-level anxiety and depression service. And many of these services are aware of cultural sensitivities, but they may not be, you know, like I said, it may not translate fully into what you want. So you've got to work with the service to mold it, to show to them what your issues are and what your challenges are. And if you don't do that, then they'll be unaware of your world, so they won't be able to help. And the help that they would give you is not going to fix your problem. So then people then go back to the imam or go back to people and say, well, you know, I need a taweez or whatever, and this, that, and the other, and it complicates matters. Yeah,
it's a vicious circle.
It's a vicious circle, constantly going round, and that's why when the whole world collapses, they then end up coming into the hospital in crisis point, because they've been round and round and round trying to find answers. I suppose one of the main advices I can give to people is that, look, when you're facing a challenge in your life, when you're feeling anxious or when you're feeling stressed or whatever, firstly, there's nothing wrong with that. You're not broken. You're not you know, possessed or anything like that. No, actually what it is your body, your mind and your health and your environment is telling you that you need to do things differently. So it's just taking a step back and thinking about, what can I do differently? If you're not eating properly and you're not sleeping properly, then your body is going to function in a different way. So it's thinking about, well, actually, maybe I just need a bit of sleep, maybe I need to change my routine and things like that. Then it's about going to access the help that you can get. So for instance, you know, online is a minefield, because Dr. Google is it's a nightmare where
it's like Mufti Google.
People can self-diagnose and everything. No, the best thing to do is actually go speak to someone in your GP practice.
I mean, we know GPs are under pressure at the moment, and people are having enormous problems accessing GPs as well.
Yeah.
And then if you do manage to get to see a GP, then they refer you to a service.
Yeah.
And the waiting time for the service is unbelievable.
At the moment, yes.
Any medical procedure that you need. So if somebody has really got to that stage where, as you say, the last stage, the crisis point. I mean, what is the likelihood that that person is going to be seen very, very soon in order to assist them? Because if they're going to be given 2 or 3 months or longer waiting time, we're talking about 1 year in some cases. There's 7 million people waiting for an appointment at the moment in hospitals, etc. I mean, this is unfortunately the situation in the country. What happens in that situation for the individual, unfortunately? Because they're going to perpetually getting worse and worse and worse day by day.
Yeah.
So where do they go?
I think the challenge is, and I'm not going to sit here and say, look, actually there aren't waiting lists. No, there are waiting lists, and there are challenges in the services. And like I said, some services are culturally sensitive, others are not. I think the thing is to get yourself listed into that system, and then to look for support mechanisms within your community. So this is why I didn't rule out going to the Imam or speaking to your friends or speaking to colleagues, that you trust and everything. And it's actually even your partner. Sometimes, again, I know depending on the nature of the issue or the nature of the problem that you're facing, it is easy for me to say, speak to your colleagues, speak to them, because you might not want to do that. You might want a confidential space and there are reliable charities, and there are reliable places where you can access that help and support. But the challenge that you've got is, not self-diagnosing and trying to manage it all yourself. Yeah. It is about networking and seeking that help and assistance. Yeah. From the Imam side, there's a lot of work currently being done to help local scholars get a wider understanding of mental health and well-being. What does it mean? Because, as I said, 99% of people are coming to the Imams first. Well, the idea is to equip them with the knowledge and understanding. And these aren't contrary to Deen. These are.
Oh no, the Deen is very clear. I mean, there's no doubt about it. I mean, although I said there are some sham Imams out there who fleece people. I mean, there was a case not far away from here a few years ago where this unfortunate lady who was very vulnerable, who had some issues, this guy came and and usually it's a man who comes in who's some Peer Sahib or an Imam. And he says, promises the world and says, Mehta, how is doing? Everything will be fine. And it took £20,000 over a few months from this lady and disappeared. And the lady was still left in the same mess. So I'm not decrying Imams at all. What I'm saying, we need to be very, very careful. There are some very genuine Imams out there who are willing to help and support people. There's no doubt about it. And Islam and the faith does play an important role in the recovery. And this is what we're talking about before we came on air, and that's something that I want to explore as we move forward in the part 2, probably in more detail. But I mean, a lot of people are anti-medication because they see, if I go to the doctor, they'll give me a tablet, diazepam or something like that, to suppress my symptoms. Now, that is, I know I've come across a lot of people who say, no, I don't want that.
Yeah.
I want, something different from just medication. I don't want to pop a pill. So what alternative is there?
The alternatives are talking therapies, But just to be clear, our body is a system, our environment is a system, and sometimes medication might be required, depending on the nature of the issue.
I understand that.
So I don't want to appear like completely anti-medication. You've got to work out what the issue is, and the specialist has to help you navigate that field. I don't think it should be a blanket no medication, because actually
I'm not advocating that. What I'm saying, I've heard people say, I don't want to be popping a pill. That's what I'm saying.
And I think the challenge is that actually there are a number of opportunities for people to talk about their challenges, to be creative about their challenges. So one of the workshops I run, for instance, it looks at people using their games or the games that they play or the things that they draw on paint and things like that in a way of expressing, because they don't want to talk about the issues that they face.
I was going to come back to talking therapies. I know we're running out of time. We're going to be going to a break. A lot of people, because of the issues that they face, are very shy to open up to it.
Yeah.
That's one of the biggest issues that we have in our community.
Yeah.
They don't want other people to know.
No.
कि मुझे ये, I've got this issue, and therefore they don't. This talking therapies. I understand the importance and the value that it plays in people's lives, but obviously in our community that is not. There aren't the mechanisms, the structures in the place as they are in other communities, are there?
I think there are. It's just using the terminology. So when we go to masjid, then a term that we sometimes use is mashwara, is to consult one another. Actually, that's what talking therapies is about. You're consulting somebody else to give you a different perspective on the challenge you face, and that's essentially what talking therapies is. It's about helping you look at a challenge or a problem from a different angle.
But I mean, we're going to break. Do we have people in our communities who A, understand what the mental health issue is, and B, sufficiently knowledgeable to be able to talk about it, and C, actually feed back in a constructive way some of the responses that will help the individual in particular? We're going for a break. I hope so far the discussion I'm having with Dr. Wajid Khan is something that you find interesting and valuable. Of course, if you want to ring in and share any thoughts that you may have, please feel free to do so. The phone number is 01274 214 299. These are very important topics that we're talking about today, and I'm sure there are many outside watching, maybe wanting to phone in or have somebody that who is affected by this. Don't go away. Inshallah, we'll be back very soon. Take care. Assalamu alaikum wa rahmatullahi wa barakatuh.